Greetings, my name is Dr. Melissa Michaels, and I was first diagnosed with ovarian or fallopian tube cancer, in my case, on March 17th in the year 2017. And as of a year ago, I have stopped all allopathic treatment, chemotherapy, and prior to that I had surgery. And I've had no evidence of disease for well over a year, 15, 16 months at this point. I'd like to talk a little bit about what my healing journey was like, because I was so blessed to have access to not only the most extraordinary team of oncologists, a surgeon, and an oncologist who was tracking my chemotherapy, and I had intraperitoneal chemotherapy and IV, but I also built a team around myself of complementary caregivers. As a person who had always looked for an integrative approach to well-being, this wasn't a new concept to me. What was actually more new was really relying on the most conventional forms of medicine for healing. I was so grateful to have access to chemotherapy and surgery and to be able to use this heroic way of eradicating a very fast-moving and progressed cancer. But for me, that really wasn't enough, because one, I wanted to create a climate inside my body that was inhospitable to the further growth of cancer. And that required really understanding the nature of my gut and my metabolism and my immune system and really my psychology even, so that I could work with how stress and how a childhood of yeast infections and how at times a not so great diet, how all those things were affecting me and allowed my system to grow cancer. So I wanted to work with my body in a way that allowed me to move towards more optimal health, especially after these strong treatments of chemotherapy and surgery. But while I was going through those treatments, I also needed an enormous amount of what I call complementary care. For example, when I would come home from the chemotherapy treatments, I would have sensations in this body that were horrific. I would have searing, cutting sensations in my gut, in particular from the intraperitoneal chemotherapy. And I was able to call a homeopathic doctor who would say, "Oh, there's Staph aureus. Your symptoms indicate this remedy." And I was able to then take it and literally have total relief from this kind of pain that is hard to even communicate. It was so extreme. It was like razor blades were cutting inside my stomach. So I was blessed to have access to good homeopathic care. I used that also post-surgery to help clear some of the impacts of the anesthesia, and also, again, to help work with some of the strong sensations that happened at the surgical site. I also was blessed to have friends and naturopathic doctors around who helped me both with acupuncture, and I did a great deal of acupuncture through this process, in particular through the chemotherapy, just to help my body continue to remember what normal is, and to pay attention to my organs that were being so overstimulated by the impact of the chemotherapy. My liver was needing to detox at such a high level, and to have the support of the Chinese needles, the acupuncture, was critical. Also to keep my immune system, which was being so compromised by the chemotherapy, supported in any way I possibly could, through the food I was eating, through the naturopathic supplements that I was taking, and through the acupuncture. What was also really important is that I did my own research, and I asked my team to help me make sure that anything I was doing while I was going through these treatments was not contraindicated for those treatments, that was not diluting the power of the chemotherapy. And there's really good literature out there to help us cross-reference if vitamin B actually is contraindicated for this kind of chemotherapy or other kinds of supplements. And I really encourage all of us to learn about these things, because there's a wealth of intelligence that comes from more traditional kinds of healings that can really support our bodies as we are eradicating this disease that is depleting our basic well-being and life force. And finding our own way to bring these two complementary ways of healing together it's our birthright, actually. And I will be really honest that there were doctors who sometimes said, don't do that, or they said, I don't think that's going to be effective, or that's not so relevant to healing from cancer. I had to take with great discernment and care their ideas in, and I had to filter them through my own research and the intelligence from other kinds of doctors who also understand about healing just through a different way. So I just want to say, don't be discouraged by people's different specialties and the fact that they don't necessarily know about one another. That special integration can happen within each of us in a way that is different than anybody who's ever come before us, or maybe anybody who will come after us. But it really makes a difference. I got through this in such a positive and efficient way. And I just want to also say that just movement and nature were some of my biggest healing allies on the journey. Thank you. Blessings on yours.